Sweet evangelism.
Okay, well, welcome everybody. Good afternoon. Buenas tardes. Thank you so much for joining us. I am Ana Diaz-Rui. I'm the PI of the Drexel Center for Climate Change and Urban Health here at the Urban Health Collaborative at Drexel University. Today we are very happy to host one of the webinars that is part of the series hosted by the CCUH, or Climate Change and Urban Health Research Center. And before I introduce today's speaker, just a reminder that this is the last webinar for this academic year, but we will be starting back up in September. And you can see our next two speakers featured on the slide. So be sure to mark your calendars for that. So today we're very fortunate to have with us Professor Stella Hartinger. She is an associate professor at Universidad Peruana Cayetano Heredia in Peru. She's an environmental health scientist, and she leads the unit for environmental development, health, and environment, and also co-directs CLIMA, which is the Center for Latin American Research on Climate Change and Health. So CLIMA, very appropriate acronym for that center. She has conducted research and led projects in a number of areas related to environment and health, climate change and health, interventions on the environment and health impacts. Most importantly, she has been very involved in a number of initiatives related to addressing the health impacts of climate change, including authoring 5 reports that are part of the Lancet Countdown, and she is currently director of the Lancet Countdown for Latin America. And so we want to thank her for joining us today. We know she gives lots of talks, and we're very appreciative that she's able to make time for us. So she'll be speaking for about 45 minutes or so, and then we'll have some time for comments and Q&A. So thank you so much, Stella, for joining us.
No, thank you for inviting me, and definitely I'm gonna change my bio. It's too long. Can you see my screen?
Yeah. Yes.
Okay, perfect. So give me 1 second so that I can take this out of the way. Okay. So again, thank you for inviting me. I'm going to tell you a little bit of what we do in the Lancet Countdown, especially in what we do in Latin America and how we started actually, and then a little bit on the report, on the 2 reports that we already published. So I'll give you the findings on those. So for starters, so this is an initiative that started in 2005 with the Lancet Countdown Commission for Climate Change and Health. In that commission, that first report, and since then we've actually published 1 global report each year. What was concluded is that anthropogenic climate change threatens to undermine the past 50 years of gains in public health. And I think this couldn't be more truer to what we're seeing now. And after 8 years, or almost 9 years now or more, we see that this is already happening. So as I said, each year since we actually started publishing the report, we've produced 1 of the reports. But around 2020, especially when unfortunately COVID was around, what we started to realize with the Lancet reports, it's that it did not really represent what was happening in other regions. The biggest focus from the Lancet started to become the US, the UK, India, China, maybe Australia, and a little bit of Brazil was also featured in the report. But what happens with the regions or within the regions and with other countries and how they're going to respond to the climate to the climate change threats was not really evident. So in 2020, the Global Lancet decided that it was important that we start opening regional hubs so that the growing evidence that we're seeing between the intersection and climate change and health is also representative of our regions. What we saw in 2020 is that the vast majority of the studies are coming from high-income countries, sometimes making the applicability and generalization of these findings a little bit complicated for our policymakers. And most importantly is that our policymakers did not understand that climate change impacts health. That's one of the things, that's one of the biggest things that one of our biggest challenges when we talk about this topic, and is that they don't think that actually climate change affects health. They think that it's something foreign that happens or happened because of high-income countries' emissions, and that has nothing to do with us. So really, these regional reports became extremely timely to bring these difficulties, bring all the complexities that regions such as ours comes with, really. So where we also started when we wrote our first report, that it was the South American Lancet report, was that we started in a place where the policy was not in place. There was not a lot of evidence available for the region. Health was not considered part or an impact or linked to climate change. So I immediately recognized the urgency to collect, analyze, and produce more research that addresses the major health issues of climate change in a wide range of climates and populations. I did not add this slide, but it's important to mention that for Latin America, there's specific complexities. The first one is that we must challenge, for example, our growing urbanization. 80% of our populations will be living in urban settings in the next 10 years or so. We have a very big indigenous communities and populations that are always underrepresented, and that they do not belong or are part of the dialogue. We are seeing deforestations due to different things, especially agriculture expands in the region. So we have to tackle different things that not necessarily are reflected in other regions of the country. So about us, we are the regional center of the Global Lancet Countdown. The mandate is to promote and develop research on the impacts of climate change on health in the Latin American region. And our aim is that through research and partnership, we aim to identify, study, communicate the health impacts of climate change. We do this through three things. So we are trying to increase the research, increase capacities, and increase communication of this problem. So three tiny things. So since we started, we've actually grown. The Lancet Countdown Latin America is an independent multidisciplinary collaborations that bring together 23 academic institutions and UN agencies from the region. We are right now 34 researchers from different disciplines that are writing this report every year. The vast majority of our authors comes from the 17 countries in the regions. And this is basically how we look like. So we have people that are from Peru, from Chile, from Mexico. We have people that are coming from Colombia. I'm just looking at the faces and saying the names. So Colombia, Guatemala, Brazil, Argentina, again, Colombia, Costa Rica, again, Brazil, and Marina coming from Argentina and Costa Rica again. So we actually we feel that we have a very nice representation and understanding of the area. That was another big issue that we wanted to tackle. The global report is basically written by researchers that are coming from high middle income countries. And that has been a critique for us. And I think that we learned from that critique, and what we're trying to do is have a report that is that's written by Latin Americans, so that we can actually express our problematics correctly, our problems correctly. We do different type of research apart from the report. We've written several viewpoints since we started in 2020. We have presented, or last year we did a series of scoping reviews with the aims to identify the gaps linked to impact, adaptation, mitigation, and health co-benefits. what is the economics, what is the impact of governance and public engagement research in the area. So this is one of the things that we wanted to understand was where were the research gaps, what did we have to fill as the Lancet, and this is one of the products that came out from that analysis and these scoping reviews. Basically what we found, and I will try to summarize this quite a bit before I go into the report, is that there's very little research linked to the reduction of tropical glaciers in the area, very little research that is linked with food production, agriculture, and its impact on malnutrition. We also don't understand what are the different responses that the communities are having towards this. We can't differentiate right now from the literature that's available for the region if the impact is only coming because of climate change or is it just climate. So this attribution to separate this difference between these two is not really well established. We also see that we're lacking information on deforestation and land use change in the area, despite being one of the biggest issues that we're facing. Very little information about exposure to forest fires and ambient air pollution, and in general, air pollution research in the area. And this is quite evident if you see the environmental networks for air pollution monitoring are basically non-existing in our setting. I just wanted to talk about one of the scoping reviews, and this is the scoping review that's linked with, and I'm sorry that the slide remained in Spanish. I was trying to translate them in the morning. This scoping review, we couldn't actually do a scoping review for adaptation strategies in Latin America. There was no literature found on adaptation strategies that had been implemented and that there was a key finding, whichever it was. So what we did was we analyzed 38 national documents from the national adaptation plans, the NDCs, the HNAPs, from the 12 South American countries, because we wanted to understand if the NAPs and NDCs were including health in their within their plans, their adaptation plans. What we found, and we did ad hoc scores to determine if there were adaptation proposals from the different sectors that were actually considering health and thinking health as an outcome. So what we found was actually a little bit heartbreaking. I'm trying to condense this information. It's a big one, so you're welcome to then to read the paper. But what we found is that for most of the countries, you can see here that we have Argentina and all the countries here on the top, and then we have the different sectors that we tried to look if health was something that they were considering as part of their adaptation measures. And what we found is that, for example, in agriculture and food, when they talk about the baseline or provide information about health in that sector, they do recognize that health would have an impact or would be impacted if we did not do adaptation measures for agriculture and food security. But when we go to what are the adaptation proposals, it really depends on the country, but but they were really not as specific by each of the countries. If we then go to see who is leading the adaptation measure, we see that there is very little clarity in who is actually leading the initiatives. When we go to finance, again, the fundings are really not allocated necessarily. And when we go to see if there's progress indicators of those adaptation measures that are being implemented, we see that there's basically nothing. So what we're seeing in the national adaptation plans, the NDCs or the in-country communications is that they know that something's happening. They know that some of these sectors will be affected by climate change, that there will be some of an impact towards health, but they're really not including any adaptation measures that could actually help to prevent this. And if you see, for example, cities and infrastructure in Peru, what we see is that they really don't consider health to be an issue for cities and infrastructure, no, which is mind-blowing. The same with risk disaster in Argentina, or education and communication, or energy for that matter. So there's really a disconnect from the different sectors, or from the other sectors, that health would be one of the biggest consequences of climate change. Another of the big portions of big issues that we work on the center is we want to expand our communications and political engagement at a national level. So we really need to bring or take our message or disseminate our findings to key stakeholders in the different countries, so that policymakers can actually use the evidence to do some kind of change. So in the past, we have written policy briefs. We've written more than 20 policy briefs, given it to Congress, given it to different stakeholders. But we weren't sure about the impact that we were having by providing this information. So this year we decided to create country profiles for the 17 countries. So what we're doing is selecting some of the indicators, putting it in a summarized version, and then giving it to policymakers. Or every event that we go, we're trying to share it. So we're exploring different ways of communication and communicating our findings that we're having. So that's a little bit of what we're doing also, apart from just writing the reports. So now we can actually go for the Lancet report. This is the second report that we've published. The first report was only for South America. This report is now called Latin America because we expanded 4 more countries, and we included Mexico and 5 Central American countries. This report really starts and it's framed around what happened in 2023. What we saw is a series of climatological and political events in 2023. We really, in the region, faced unprecedented weather events, including floods, the ones that we, even right now, we're continuing to feel this. For example, what happened in Brazil. So floods, heat waves, droughts, hurricanes, which impacted the ecosystem, population, infrastructure, and a lot of the social progress. We also saw in the region the transition from the Niña to El Niño that has actually increased global temperatures, and it has happened the same with us. We are now seeing the potential of crossing the threshold of 1.5 because of this transition. But the other thing that we saw in 2023 is a bit step in the political front. So we saw the first COP28 Health Day, where finally the impacts of climate change on health are recognized by the countries, and 120 plus countries are advocating for the resilient, sustainability, and equitable health systems to actually counteract what's going to happen for climate change. Unfortunately, what we also saw last year is that the first global stocktake revealed a gap between the current progress and the goals set in the Paris Agreement. And there were a lot of concerns regarding the discussion of the continued use of fossil fuels despite ongoing negotiations to recalibrate climate initiatives. So this is where we started with this report. So this is what we wanted to tackle. And we set 3 questions to actually do this: how do we achieve the necessary change? How do we address vulnerabilities in a region with entrenched social inequalities? This is one of the big differences with the rest of the global north. And how can we promote intersectoral collaboration to conduct climate change, which is a little bit, and that's why I focused in one of the scopings. No, how do we make the other sectors understand that health is not standalone? We won't make it. So the Lancet Countdown works with 5 working groups. The first working group is the one in the middle. I'm sorry, this is half Spanish, half English. It's about impacts, exposures, and vulnerabilities towards climate change. Our second group is adaptation and resilient plans for health. Our third group is linked to mitigation and health co-benefits. And of course, the big red circle talking about economics and finance and public and policy commitments. For this year, we included 9 more indicators than we did last year, and the team created 2 new indicators to be included in the regional report. We included an indicator on loss of tree cover and health, And we included an indicator in commitment of social media to climate change and health. What we're finding, and this is unfortunate, is unfortunately, we will continue to see that the health impacts continue to increase in the region. So what we're seeing is that population exposure to extreme heat is associated with multiple negative health outcomes, ranging from malaise and headaches to strokes and death. And what we're seeing is that the American populations are exposed to an average increase in summer temperatures of 0.38 degrees compared to the baseline. But what we also see is that this is quite different depending on the country that you're at or the even specific areas of the country. So the highest temperature anomalies that we're seeing recorded in summer months for Paraguay, for example, is an increase of 1.9 degrees. In Argentina is an increase of 1.2 degrees. In Uruguay is an increase of 0.9 degrees. So this is actually quite different. And also, unfortunately, we see that this exposure to heat is continuous and continues to increase in the last decade, despite the cooling effect of the El Niño. So this is a trend, and we will continue to see it increase. A second of their indicators is, so we see that there is an increase in heat, but we also are interested in exploring the exposure of vulnerable populations to those heat waves. So we see that this increased heat results on heat wave, which is also an important risk factor for health and well-being. For our report, we are defining heat waves as 2 or more days with unusually high ambient temperatures during the day or night. And again, this increase in temperature will not affect all populations or all people equally. It is worst in people with comorbidities or older adults, as you can see, or young children. And again, this will be different depending on the country and the level of urbanization that we find in each of these countries. What we see is an increase in percentage of number of person days exposure of heat waves for children under 1 has increased around 200%. This increase a little bit higher in Guatemala, Ecuador, and Venezuela, all of them above 250%. I forgot to put the percentages. And of course, I flagged Peru because this was for a presentation for Peru. I apologize for that. Then we also see an increase in heat waves exposure in adults above 65, which in general has experienced an increase of 271% of heat wave days per year. But what does this mean, really? Well, what this means is that this increased exposure is related to an increase of heat-related deaths, and that in the total in all of Latin America represents an 100% increase. And again, for certain countries, this is much higher. For Ecuador, we're seeing an increase of above 300%, El Salvador, Honduras, and Guatemala. So something more happening in Central American countries. You must also remember that in a region such as ours, adaptations linked, like for example, to having air conditioning is not something that it's really normal in our settings. So it's not something that we could implement easily. Another of our indicators is wildfires or extreme events. Next year, we will add a couple more extreme events, but this year we only included wildfires. This is a multi-level risk to health and well-being because it can either cause direct physical harm or death, or it can aggravate acute or chronic lung diseases by inhaling smoke, increasing morbidity and mortality. And of course, it would also link to the loss of property and can have an impact on mental health. This is also important because in difference with high middle income countries, most of our houses are not insured. So everything or every loss that the population has for any extreme event is coming out of pocket in our region. So it's quite a different scenario when you lose everything from one day to the next. What we're seeing in this slide is the increase in days in which wildfires are occurring. The highest increases that we're seeing is in Chile, Venezuela, Argentina, and Colombia. Oh, pardon, Colombia and Brazil, I apologize. Finally, we have another indicator that's looking of climate suitability for the transmission of infectious diseases. Climate change, of course, influences the transmission of vectors and waterborne diseases such as dengue and vibriosis. This is especially important in regions where the vector and the microorganisms are endemic, such as Latin America. So Latin America is an endemic region for dengue. What we're seeing is an increase in climate suitability, that we measure it as an increase in the estimate of the basic reproductive number for Aedes aegypti, especially for dengue, because that's what we find in the region. And what we're finding is that there is a 54% increase. Of course, this climate suitability, again, it's different for the countries where the vector is present. The only country that does not show an increase is Chile. And the most significant increases that we've seen are in Bolivia, Peru, Brazil, and Guatemala. And these results coincide with the increase in the total number of dengue cases in recent years, especially in Bolivia and Brazil. And of course, Peru, we've had a couple of how do you say, brotes, epidemics in the past years. So up until this point of the report, we're just showing that we will continue to be impacted by this climate change. Our health will be impacted by climate change. So what we set out to do in this report is to provide at least 3 key messages, maybe 3 recommendations for our policymakers, so that we can provide or can help a little bit more in steering the conversation. So Latin American countries require cross-sectoral public policies that increase crime resilience, reduce social inequalities, improve population health, and reduce greenhouse gas emissions. I'm going to share a few indicators regarding this. So one of our biggest problems, because it's quite complex, is the interconnection of how climate change affects health. If countries did have national assessments on impact and vulnerability and adaptations, they could better understand their health-related risks. They could understand the weaknesses within the health system, and they could suggest priority interventions. These assessments could also help offer decision makers reliable and up-to-date data on generating climate policies that effectively protect health. But unfortunately for the region, the only countries that have reported carry out the vulnerability and adaptations assessments are Brazil and Guatemala. Other countries have reported that they haven't in development. We don't really know what's the level of development. This information is coming from a WHO survey. But we thought that the information or this indicator was sufficiently important to see if there were other countries that were doing the vulnerability and adaptations assessments. And we found that Argentina and Panama have published an assessment between 2019 and 2021, but has not reported to WHO. So we just picked the information from those countries. Why is it important? But for example, for Argentina, they report or they state that the vulnerability and adaptation assessment helped them prepare a grant for the Clean Climate Fund, and they got actually funding for adaptation measures for the country. So it's quite important, but not many of the countries are actually doing this. Even fewer countries are showing that they have their national adaptation plans specifically for health. The only countries that we found is Brazil, Chile, and Uruguay. Brazil was the only country that reported actually carrying it out. Chile and Uruguay, we actually had to look into their regulations within country to see if they actually had it done or carried out. Again, we have countries like Colombia, Peru, and Argentina, and a couple countries in Central America that they're saying that they have this in development. However, we haven't seen the documents, or they were not available by the time that we published this. Argentina has another document that we thought it was important to mention. They have a national health and climate change strategy in 2023. And Nicaragua approved the national climate change policy in 2020. So we see that there's some countries, or the countries are actually seeing the value. There's some increase, but it still remains very low, quite low for this region. But that's a national level. So what we're also seeing is that it is important that the cities are also making or developing their risk assessments or carrying out their needs assessment. At some point, we need to go from national to local. And this is also a very big gap. So this information is also coming from an international survey, and it's self-reported. So we don't know if information is completely accurate because, of course, it's self-reported. So what we see is that 268 municipalities have completed the survey, so have completed this risk assessment, which corresponds to less than 2% of all the potential municipalities in the region that could be carrying out this assessment. In Peru, this is even smaller, so it's only 5 municipalities that has created this or carried out the city level climate risk assessment. Of these, only half have completed the evaluations, the other ones are in progress. But as soon as you get information or as soon as they complete this information, there's key things that show up. So for South America, the cities that completed the survey detected that they should be preparing for infectious diseases, floods, extreme heat, and urban flooding. And for Central America, the municipalities should be preparing for extreme heat and extreme precipitation, floods, and infectious diseases. So it's actually a very powerful tool, but we don't know if they're not carrying it out because they don't know, they don't have the resources, or they don't know they should do it. So there is a disconnect from what's happening at the national level to what's happening at the local level. We have one indicator that is tracking one big adaptation measure, which is green urban spaces. That also this, of course, you guys know, but green urban spaces has the possibility of reducing heat and air pollution exposures. But what we're seeing again is that from the 109 urban centers that have more than 500,000 people living in them, they have very little green spaces. So what we see is that most of the cities have low, very low, or exceptionally low levels of greenery in their cities. There has not been a substantial change in the region since 2015. We only see Colombia, Nicaragua, and Venezuela, where the levels of green spaces have increased slightly. But this definitely is not being considered as a priority in our settings. In Peru, for example, there is a bill or change. They want to create a highway, an elevated highway. So they have decided that the best course of action is to cut down around 1,000 trees in the city. So again, it's this, what's happening at national level, what's happening and what happens at regional, what happens at district level, completely disarticulated what we should be doing. So maybe if we have even the legislation or we have the national adaptation plans, it's not really reaching the other levels, or there is no interest. That could also be something sad to see. Our second message or key message is that Latin American countries need to accelerate energy transitions that prioritize people's health and well-being, reduces energy poverty and air pollution, and maximizes health and economic benefits. So for us in the region, the decarbonization of energy systems is essential to meet global efforts. Cold electricity generation has increased in 2.6%, especially in countries like Honduras, Mexico, Brazil, Peru, Panama, Chile, and Guatemala. However, our region, our energy generation is really coming from low carbon energy sources, around 56%. So our region could definitely become really green, let's call it that way, also it could be something that we could achieve in the short run. So we do have this potential. But for example, and this is another example that it's happening again in Peru, is there's a law to diversify the electric matrix, but it's stuck in Congress because it's not the priority. Peru has decided that LPG stove or gas is a priority for the country because we have reserves. So so diversifying the electric matrix is not something that it's a priority for us. So again, how do we comply with what we're saying in the NDCs or what we expect to do when there are other type of economic priorities that are actually steering the conversation within our countries? In this section, we're talking about mitigation and health co-benefits. What we see, one of our indicators is domestic energy use. We know already that around 2.4 billion people, or a third of the world, the population, continue to use biomass fuels or clean or dirty fuels for cooking. This number is around 60 million in Latin America. And of course, the emissions from domestic energy use are a very big percentage of greenhouse gas emissions as well. What we're seeing is that 19.5% of Latin American population continue to use dirty fuels. In Central America, this is rural, so 46% of the rural population continue to use dirty fuels, 11% of the urban populations, and in South America, 23.3% continue to use biomass for cooking. In Peru and Paraguay, the rural population, more than 50% of the rural population continue to use biomass fuels for cooking. So what does this mean? How can it be translated? So at national level, people that are cooking with dirty fuels, their PM2.5 concentrations are around 145 micrograms per meter cubed, which is much higher than what is recommended by WHO. And even in households that are cooking with clean fuels, it's around 55 micrograms per meter cube. So anyway, we are way above the WHO standards for PM2.5 emissions. It is also important to mention, and this is another topic that we're trying to discuss a little bit more, is that for the region, around 75% use liquefied petroleum gas, LPG stoves, for cooking. And it has been recently published that NO2 gases are increasing asthma, and these emissions are linked to liquid petroleum gas. So if we want to really talk about a region that no longer use fossil fuels for cooking in this case, it's going to be very difficult to switch 75% of the population to a cleaner energy for cooking. So this is something that we will continue to have in mind and continue to track. But this is a complicated topic and a complicated discussion, especially because there is no possibility of having a clean matrix, electricity matrix, to actually shift to electricity. Okay, another of our indicators is linked to premature mortality due to ambient air pollution. What we're seeing is an increase in premature deaths for the entire region. It has increased notably in Central America, Chile, and Colombia since 2005. The mortality rates continue to be high for Chile, Peru, Brazil, and Colombia. But if we want to translate, so these are the type of indicators that now we're trying to translate to what it would mean for economically, no? So what we're seeing is that the monetized value of premature mortality is equivalent to 0.61% of the GDP, excuse me, or the average income of around 6.6 million people. So we're just trying to find also different ways to share this message, because sometimes people don't understand that what 123 premature deaths mean per million. Maybe that they think this is small, but maybe if we show what it would mean as a monetized value for how crude that sounds, that we could have a little bit more of a impact with policymakers. This is one of the indicators that we recently developed is loss of tree cover and health. 80% is due to deforestation, due to the demand of raw materials and the expansion of the agricultural land. What we're finding is that this loss of vegetation cover it's highest in Brazil, Bolivia, and Paraguay, and this is really due to the agricultural expansion. So how to stop it? This is one of this indicator, and the emissions per agriculture production or premature mortality linked to the consumption of red meats is one of the indicators that we have a lot of pushback because policymakers or people that are in the industry believe that we are trying to reduce meat consumption completely, but what we are actually trying is to have comprehensive conservation strategies for sustainable agricultural practice and a good urban planning. Another of our, and I apologize, this one really is half English and Spanish. Another of our indicators is transportation or road transportation in Latin America. This one is very important because 20% of the premature mortality attributed to PM 2.5 comes from the transportation sector. And over the years, the region has seen a significant growth in energy use for road transport, which obviously has environmental and health consequences. And as I mentioned briefly at the beginning, Latin American countries are facing a rapid urbanization, and we have a very bad public transportation system, and there's only an increase in car ownership. So what we're seeing is that fossil fuels continue to dominate road transport in around 96%. The biofuels has increased to 3.5%, and the countries that are actually using more biofuels is Bolivia, Brazil, Chile, Ecuador, Guatemala, and Peru. But I'm not so sure that the use of this type of biofuels is also good because it also leads to an increase in deforestation. But anyway, this is something that we really report on because it's something that we want to see a difference, but we haven't seen a difference in this indicator or this change in fuels for the past years that we've published the report. Finally, the last key message that we found is that Latin American countries need to increase climate finance through permanent financial commitments and multilateral development banks to foster climate resilient development pathways. We have seen an increase in clean energy investment in Latin America of around $58 billion, which is a 6.8 increase. And it has exceeded the investment in fossil fuels by 30%. So that's actually good news. But for example, the Global Climate Fund has destined around $486 million for adaptation projects. And that was a reduction of 16% from previous years. And unfortunately, only around 12% of that money is going to projects that are linked or those projects that are being used for adaptations for health. So there's really a very big gap for the countries to a very big gap for adaptation to health projects nor funding. So the costs related to heat related to mortality, we have calculated that the losses exceed the equivalent of the average income of 451 people annually. We only calculate this for people above 65 years old for Latin America, so we could be underestimating the real costs. The annual monetized costs have also increased, and this, again, it depends on the country where the losses are or bigger or higher. Another of our indicators is trying to track the loss of income due to heat-related reduction in workload capacity. What we're finding in the sector is that the total potential income loss from a reduction of labor capacity is around 1.3% of the regional GDP. The countries that are most affected are Venezuela, Nicaragua, Salvador, and Honduras. And agriculture and construction sectors are the ones that experience the higher losses. And in this indicator, we're not capturing it, but there is increased body of evidence that it's saying that agricultural workers are having increased renal disease linked to the to exposure to increased heat. So this is something that we will also try to explore with our Central American partners, where they are actually seeing this increase in disease. I'm almost finished, but this is one that I really wanted to also share, is that in the region, we continue to subsidize fossil fuels to an equivalent of around $28 billion. Venezuela, Argentina, Bolivia have the highest net subsidies. And unfortunately, what we try to do is to link the subsidies to what we are actually having in health expenditures. And the subsidies for Venezuela, Ecuador, Bolivia, and Argentina are equivalent to 80, 85, 29, 23, and 50% of their total health expenditure. So this really gives us an idea of how the government actually spends their money and the value that they're seeing. So at the beginning, I asked, how do we achieve the necessary change? What we think at the Lancet is the entire society must get involved in action against climate change. What we see is that the media coverage has increased, the social engagement has increased, but information coming from scientists or from educational topics are not followed as much as information coming from politicians or influencers. And one of the sad things that we see in the region, that's something that I also started, and that's where everything started, is that we have increased our publications on health and climate change, but we all still only represent 4% of the global publications in total. So it means that we still have a lot of work to do in Latin America. And I'll stop there. Thank you.
So if anyone has any questions and want to drop them in the chat, we'll be reading them aloud, or if anyone has a question in person here too. Anyone? There's a question in the Q&A, but it says that they want to ask the question. So if you can type it, we'll read it once you have it. Actually, have a question on the hearing person. I was looking at the figures for some of the mortality related statistics that you showed, and I was wondering about because it seems to be a huge effort to calculate heat or air pollution related mortality for the whole region. And do you have any thoughts about the balance between being able to calculate it for the whole region using models versus actually using mortality and similar data from each country? You know, the balance between depth and breadth, essentially, right? And I'm guessing this idea of being too accurate may not be in some cases.
I must say, or must flag, that we do have a limitation for this report, and I think you just nailed that limitation. We need to use information that it's available for the report from 190 countries. So it would be great if we could have information that is coming from each specific country, if we could actually contact them and get this information to do it, but it's basically impossible, and we really rely a lot of where this information is coming from. We rely from international sources. So I understand that there is a balance, and of course we would like to, for example, we would love to have information that it's not only at national level but at subnational level, to be a little bit stay more precise on what we are finding. But again, this is also another limitation that we're having. We will try to continue to explore possibilities to work with the countries with governmental information directly, but it's tough, and it's difficult to do.
Thank you.
Yeah. So you are talking about a lot of indicators and other things. I was just wondering about finding similar vulnerable, smaller geographic area across the world. So this could be like reducing the use of resource for similar geographic areas, like in granular level. What I mean that consider like synchronizing or learning from a very similar area, and you can like adapt their policy or the learning from that particular area to your Latin American side.
Mhm.
More example, I would say, consider like LMIC country like Bangladesh. They are agriculture based, and you have some countries in Latin America, they are agriculture based. So some coastal area or the area with river, they have maybe similar kind of things, similar kind of economy, similar kind of health inequalities or something like that. So maybe a river is dying or flooding is affecting them, or the water level is rising. So those things have impact on their local economy, health access, migration inequalities, and the risk of some increased risk of some disease. I'm thinking of an indicator that finding similar areas, very smaller similar geographic areas, like from Bangladesh, and you have to find out similar areas from like Guatemala, and then you can like synchronize the learning, and you are reducing the resources. So do you have anything like thinking like some kind of this kind of indicator?
We haven't thought about an indicator that looks like that. Again, there's like some requirements to the production of an indicator. So globally, we need to have at least for the introduction of, or the inclusion of an indicator of around 150 countries to be considered as part of the indicator. For us in the region, it's around 12 to 15 countries that we should have the information. However, what you're saying, we do have a space where we are considering writing certain case studies that would bring a little bit more of clarity to specific areas or to specific topics. We are exploring the possibility of maybe writing something linked, for example, Amazonia, and grab the countries that are from Amazonia, go a little bit more in depth, have a subnational view of what's happening in those countries. So we are trying to explore, because we recognize that we're still a little bit at national level, and we can't see or can't see the differences between urban, rural, or what's happening in other settings. So we are discussing the possibility of producing some case studies that have a comparative value. We did not think it with Bangladesh, though. We did think it with countries within Latin America.
Okay, so we have a question from Jordan in the Q&A. I have seen a lot of violence against social and environmental activists, at least in Mexico. Have you thought about including this variable as an indicator?
No, but that's just interesting. The other indicators that we're thinking about including are closer linked to funding. That's something that we want to explore, to see if the countries are actually funding projects that are linked with climate change and health. We had not thought about including information on violence toward activists. No, we haven't. But maybe if there's like a source, or if you know of, we can maybe discuss.
Yeah, thank you so much for your talk. You ended with a slide showing, the very little research that's coming out of Latin America. So I was wondering if you had any thoughts on, what kinds of research do you think would be most useful? Are there particular niche areas, or, what kind of focus do you think would be most useful in the research?
So we are definitely, we've definitely identified several areas that are not being touched upon. One of them is the reduction of the tropical glaciers in South America. That's something interesting that we want to talk about. It's linked to the water cycle. So what's going to happen linked to those? Other topics that are not being discussed or not being published on, it's this agriculture, food security, malnutrition. This is something that it's also lacking in the area. Any topic that it's linked to mental health at mental health and linked to climate change, or mental health linked to extreme events. Other topics that have not been discussed is migration, no, due to or displaced populations due to climate change. It's very complicated to measure, and very little information on indigenous communities, adaptation strategies, if they're tailored for them. So yeah, there are many topics that are neglected right now in Latin America.
Thank you.
We have a last question in the chat. Well, before that, we have a comment from Nelson Gubella saying that I think the issue of violence against environmental activists will be featured in the next ISA conference in Santiago, Chile. I don't know if that's what you meant, Nelson. I hope that's it. And then question from Thomas. You commented on how impact formats resonate more or less with decision makers, premature deaths, monetized values, etc. We have many options, but none of them are straightforward. Which health impact indicators do you think resonate better, and what would make those more graspable by decision makers? And any thoughts on balancing accuracy versus simplification, how to package indicators, the whole package?
This is like a very complicated question, Thomas, because we go back and forth in actually how to present our findings, how to present how to present our findings in a way that policymakers understand what we're doing. So we've gone through policy briefs that were 2 to 3 pages, to fact sheets by countries that it's really 1 page. We go through social media, we do dissemination, we do presentations, we go to forums, we go to different places to actually share the message. So to tell you the truth, I'm not so sure which one works best. This is something that I think we're also learning as scientists, is how to how to share the information in a timely manner, in a manner that a lot of people understand. So I really don't have an answer to your question. We're just trying our different strategies. I hope that, for example, this forum is something that will bring the message, or will expand the message a little bit more.
Thank you. And thank you for your time. And thank you, everyone, for attending the last webinar of the academic year. And we hope to see you again in September.
Hola, Nelson. Nos encontramos en todos lados. Me encanta.
Sí, sí, acá estamos.
La próxima vez presenta tú.
No, ellos todos ya me conocen.
Pero bueno, Nelson, me encanta que nos encontremos en diferentes lugares. Gracias por el espacio a todos. Y la próxima vez realmente, Nelson, ya voy a mandar la presentación para que tú la hagas.
Gracias.
Okay, bye bye.
Muchas gracias por la invitación. Chao.
Gracias.